I'm Megan Fair. I'm a sophomore at Deep Run, and I'm here because I broke my leg and I'm just sharing my experience.
Megan is in recovery after having an accident, and she had 3 broken bones, 2 in her leg and 1 in her ankle. And we found Dr. Kim, who helped her, and we're just here to talk about how great of an experience we had.
We were at practice on a Wednesday, and it was just like a normal practice, and we were doing pyramid, and we were just going over and over, just practicing, getting it down. And the skill that I actually fell on, I was able to do. I did it many times. It was just an accident that happened to happen. So I was flying, and I was at the top, and I fell forward, hit the ground, and I just remember laying on my back, looking down, and my leg was snapped. And I just went into shock, really.
Because it was such a bad fall, all the adults in the room were engaged with caring for Megan. And so the first person to be able to pick up the phone and call me was another teenager. Imagine a room of 19 cheerleaders and someone's on the floor and her leg is pointing, is it like this, with her identical twin looking on. So the call, was like, wait, where do we begin?
She broke her leg fairly severely in the lower leg. And I saw her, I think, 2 to 3 days after her initial injury, after being seen in the emergency room. And we reviewed her x-rays and we reviewed her leg. And actually looking at her leg, we saw something else at the ankle. So she had actually sustained 2 separate injuries where she broke her tibia, which is a large bone, and then she also broke the ankle, which is connected to the tibia, but just a small portion that was the weight-bearing surface of the ankle.
When we finally, through a whole bunch of paths, landed in Dr. Kim's office, it was, he made an appointment for us before appointments started, like 8 a.m. on a Tuesday morning. All he had was some x-rays that had been forwarded to him. And we were in an MRI by 10 and in surgery by noon that day. I didn't have to, as a mom, worry about whether it was the right decision because he was so confident.
Because of the severity of her injury, after I looked at the x-rays, I knew she was going to need an operation. And of course, trying to talk to young ladies about an operation, scars, going to sleep, and those are all scary things. And, we try our best to try to calm them. We try our best to try to reassure them that it will be okay.
I have one more surgery, and it's in a week. So I'm looking forward to that, and that will be just taking out 2 rods from my leg.
The next surgery is actually fairly simple, to remove the rods that are in her leg. I do use some smaller implantation so that I can remove it after the bones are healed, and then they don't have any implants or metal things in their body after all the healing has completed. I think she'll be able to return to her full activities. I think she'll be able to go back to cheerleading and jumping and tumbling.
Definitely would recommend Chippenham because the accessibility of the staff, whether it's the receptionists at the clinic or the PAs or the nurses or Dr. Kim himself, this isn't what's closest to us. It's not what's most convenient, but I would absolutely recommend Chippenham Hospital and Ortho Virginia and everybody here.